Welcome to Safe and Sound, sponsored by White Mountain Fire and Life Safety. I am your host, Kirk Webb, and today on the show we have Danielle Poteet, Pediatric Nurse Coordinator from Summit Healthcare. Welcome to the show.
Thank you.
So, how's life been treating you?
It's been pretty good. Busy, but really good.
Great. Give us a little background of kind of what it is that you do, your training and expertise, and kind of where you're at this point.
So I'm the Pediatric Nurse Coordinator for the Emergency Department. So what I do is performance improvement, quality control, education. I do chart reviews and look for trends and what we're seeing come through the Emergency Department. I follow up and work with DCS on referrals to DCS. And I'm also a forensic nurse examiner. So I do off-site forensic medical examinations.
So you got a huge variety of things that you kind of cover there, right?
Yes.
And I know originally our show for this month, we wanted to discuss public education, which is a huge component of what you do, correct?
Absolutely.
So, and same thing with us. October for us is Fire Prevention Month, and we typically follow the National Fire Protection Association theme, which this year is serving up safety while cooking in the kitchen, because as we know from our statistics that residential home fires, the highest percentage of those fires are started from the kitchen. So we're trying to kind of target fire safety, and not just only with kids, which that's what you deal with most of your education, is that pediatric side of things, but also all ages of people, because there again, it's not always kids cooking in the kitchen, but we're seeing a lot of that happening more and more these days with latchkey kids. So as they're getting older, they're starting to do a little more cooking and having to, because I mean, granted, it's tough to raise a family without two-parent income.
Right.
So even single parents are having to have their kids babysat or daycare or things like that. But then the older ones are spending more time at home, maybe having to pick up some of that cooking. Yeah. So as we get into the education side of things, what are some of the trends that, as we're dealing with our mental health side of things, what are some of the trends that you're seeing in the emergency room?
Right now, just for this month, we've seen a huge spike in mental health across the board, children and adults. My thing is, I've seen in my job that I've seen a huge spike in the pediatric components. Just for this month, we've already seen over 20 pediatric psychiatric patients. And about half of those have been transferred to inpatient facilities where they needed more intensive therapy. And it's not just us right here locally or even statewide, it's nationally that's going on. Finding bed searches, finding pediatric inpatient beds has been really difficult lately. We've even had to transfer some patients out of state to find beds for them. And we usually see a little bit of an increase in September when the kids start back to school. There's more stress with that, but the numbers this year for this month are dramatically higher than what they've been in the past. So was concerned and reached out to the county and some other people to see what we could do to help our pediatric population and our adult population across the board. I think with everything going on with COVID and the changes in how kids go to school, and now, jobs, a lot of jobs have been affected. So you have incomes at home affected, increase in parental stress, which increases the children's stress. And, children and parents are being home more because a lot of the kids aren't going back to school, or they're going back to school less. So there's that more contact, and it kind of feeds off of each other. So across the board, this nation, there's been a huge increase in mental health problems right now.
In fact, I know as I was looking up, trying to find statistics on this and comparisons, it's virtually impossible to get current information as of this year, what's going on, as opposed to even last year. Right. Because CDC, they're usually 2 to 4 years behind as far as when they get those accurate numbers out. And even that, because how many of things do we actually are having occurring out in the community that never even get reported, or they never go to the ER or even to their family physician. So it's really difficult to track those numbers.
It is.
But I know that we're seeing the same kind of thing. We're doing a lot more interfacility transports of patients that are in mental crisis, and our resources locally are very limited on what's out there to help. And I know even with first responders, we've had a lot of increase in first responder suicides and things like that. So I know several years ago we started getting teams together to deal with, and we call it the critical incident stress management. Because here first responders are they're ordinary people doing an extraordinary job. Same thing with our nurses and medical staff in the hospitals. And in all of this, that cumulative stress is huge and can weigh on a person if they don't have resources to deal with the situation.
Absolutely.
You know, so I know we can't really discuss numbers because they're not available, but just seeing the trends from last year to this year, and even as this year has gone on, you know, our world is not the same. No. You know, with the COVID-19 coming about, and dealing with that. I know there's a lot of conspiracy theories out there. Right. But even without, you know, and it's interesting, one of the things I've noticed, that with the new company that does our annual physicals as our Timber Mesa Fire and Medical, I was curious to find out that vitamin D, which is kind of like being out in the sun. Well, we live in Arizona. We have a pretty high rate of being able to be in the sun and maybe accumulate that vitamin D. But finding out from the medical report, my own personal physicals showed that I was deficient in vitamin D. I'm like, how could that be? I know I get sunburned all the time. It's like I think I'm absorbing this vitamin D, but maybe I'm not, you know. And interesting, what is it that you know, vitamin D has an effect on our mental health, doesn't it?
It does. It does.
You know, and I know I had one of my sons was in the military, and he was stationed out of Fort Lewis up in Washington. And I even spent a little time myself up in Washington for a couple of years, and there's a lot of shade, cloudiness, and so a lot less sunshine that we get exposed to, and it did affect him on his mental health and being more depressed. And I know depression is one of the leading causes of people not feeling good about themselves. And what are some of the other things that we need to kind of be aware of, you know, because let's say we're the person that is not having the issue, but we need to still be aware of others around us, correct?
Right. So one of the big things, and it's a hot topic right now, especially with the teens and the youth and adults as well, is social media. You know, we've gone from a society where, you know, if you were bullied at school, when you got home, the bullying stopped. Now there's no escape from it. This bullying can continue 24/7, and it spreads, and one person starts it, you know, and kids are kids, and, you know, they jump on the bandwagon, so to speak, with others, and they see one person reacting and doing and treating a kid this way, and they jump on the bandwagon and they follow suit. So there's no escape from it. It's 24/7, you know. They don't, you know, unless they have somewhere where, you know, the phones are taken away or the social media is taken away. There is no escape from it. It's nonstop. The minute they wake up, there it is. You know, it doesn't go away. And then there's also there's been a lot of articles and reading on the falseness of social media. Everybody posts their perfect life. Well, we don't all have perfect lives, but, you know, the filters and, oh, look at me, I look perfect. I'm always perfect. And the person who's struggling, they look at that and they're like, well, my life's not like that at all. And so I must be, you know, a failure or a bad person. And that's not the truth. That's not the reality. The reality of it is these people are making these false lives on social media and pretending to be perfect all the time. But then they also have to live up to that of, well, this is what I've put on my social media. And now when I go to school, everybody wants me to see this perfect person all the time. And so it increases stress there. And then just some basic, you know, watching for signs and symptoms of depression, you know, sleeping a lot, changes in appetite, changes in mood, disinterested in things that normally they would be interested in, are all kind of warning signs of depression and things to watch for, just, you know, any kind of change. And there's been lots of change going on. Our you know, our youth today has been exposed to more. You know, we had, you know, our graduating class last year, they didn't get to walk in their normal traditional graduation ceremony. I'm sure that would have a huge toll on a lot of kids. Some kids handled it really well and didn't care, you know, and we tried to, as a community, provide other things for them. But for some kids, that's what they look forward to their whole lives, is being able to walk across that stage and be like, I did it, I graduated. And that was, you know, taken away from them. Right. You know, and so there's so many changes, you know, and even with my own kids, I talk about, well, I want to do this, I want this, I want to be normal. And I'm like, well, we're looking at a new normal. Normal's not going to be, will never be the same, you know, no matter what we do with this going forward, it's going to be a new normal. There's going to be changes that are long-lasting.
Exactly. In fact, when I talk to the students, I got a little bullying presentation I've taken, and we're finding that bullying is starting at younger and younger ages, and it's surprising how many, you know, and I even, bullying when I grew up and you grew up is much different than it is now, like you say, with social media, and it's just nonstop, and you know, and I can look back and my own brothers used to tease me, you know, because I was the blonde and I was the outcast. I was different. My brothers even used to tell me that I wasn't even adopted. I was found under a cow pie. I've gotten past that. I'm okay with it because I'm bigger than they are now.
There you go.
I can sit on them. But no, I mean, bullying was really more physical back then.
Very much so.
And now it's changed to where it's more mental. And even, you know, one of the questions I pose to when I'm teaching the class is, you know, one, what is normal? There is no normal.
No.
And two, how often are we picking on ourselves? You know, if we don't like bullies, how often are we bullying ourselves? And, you know, and that's where that depression piece starts kicking in tremendously. And you talk about somebody appearing to be perfect, and now as that person, can they live up to their own perception?
Right.
And we're seeing a lot of that kind of mental health crisis going on. And what are some of the options that I mean, do our kids and adults even aware of where they can reach out for help? You know, and that's something that's probably not publicized very much, is it? Probably
not, and probably not enough. I know all of the schools, especially the junior highs and the high schools, all have counselors in them. I'm not sure about the elementary schools. We've got several facilities. Summit has behavioral health. Change Point has behavioral health options. There's lots of independent counselors in the community that people can reach out to. Your faith, you know, lots of churches have different opportunities to reach out and help out, you know. But I think the biggest thing that what I would like to see people know is to look for help, reach out, talk to somebody. If you're struggling and you're having a hard time, don't go to social media looking for help, because you're not going to find it there. But reach out to a friend, a family member, you know, somebody, a teacher at school, you know, someone in your church, you know, an advisor at church, somebody that you could look up to and trust that can help you find the resources. There's lots and lots of resources out there. and they're not all conventional. You know, a lot of places are doing, you know, Skype therapy now because of COVID, and people couldn't get in to see their doctors, and they found that, hey, this is an easier way to reach out to people, make it more accessible. Maybe
Right.
driving to an appointment's difficult for some families. Well, now you can, you know, meet with a counselor via Skype or Zoom or whatever, and make it more accessible. You stay in the comfort of your own home and do it. So there's lots of help out there. Just reach out for it and look for it.
Right. Don't make that your last option of harming yourself.
Right.
You know, and I know one of the things that when I'm talking to the kids, that there's a simple, for a text, you know, 741-741, you can use that number to text, and it gets you to a counselor or somebody that's been trained on how to, you know, look at getting you some help, getting that, you know, because I know when I'm talking about the presentation, one of the things I ask the kids is, how many of them actually get along with their parents and can talk to their parents about virtually anything? And I know kids these days seem to have a better relationship with their parents. I tell them, it's like, you know what? Now, my parents were stupid. There was no way I was going to go talk to my parents about anything personal. And, you know, because that just wasn't how things were done. So things have changed. And I know even with my own children that they are more comfortable coming to us with issues and problems they may be having. But I also wonder still, how many times do they not feel comfortable, but
Right.
they need to reach out to somebody. So if they can't go to their parents, talk to an adult or a friend. And sometimes that peer pressure, talking to friends, can be hazardous. So I kind of warn them about that, because you don't know, because they're, again, that bullying and spreading gossip and rumors tends to go from that.
Right. And it's hard, you know, and then it's, you know, and as a friend, you know, if you have a friend that comes to you and says, you know, hey, I'm struggling with this and I don't know what to do, you need to reach out for them to an adult who can help find them help, because you don't want to deal with the guilt of knowing that my friend told me she was going to kill herself and I didn't believe her and she killed herself.
Right.
And it's my fault. That's not a situation anybody wants to be in.
Get that survivor's guilt.
So, you know, if you have a friend, don't blow them off. Don't go, oh, they're just blowing off steam, they're fine, because you don't know. You don't know when or if they're going to decide to do something to themselves. And so if a friend or anybody, or you overhear something, you know, reach out, let an adult know so that they can get that person help, because you don't want to be the person who knew and not say anything.
Right. And, you know, and I think a lot of other things tend to get into that causes a, you know, person to, they get depressed and then they start self-medicating. There's, you know, I know there's lots of, you know, opioids are a big, huge thing right now. Farm parties where they go into their parents or relatives or whoever, and they get access to different medications and start taking, you know, and they're maybe taking multiple medications that interact with each other, and you know, we're seeing a huge spike in cases that deal with drug overdoses and things like that. So and it may not even be affecting somebody that's in depression. Right. They're just
somebody going out looking for a little bit of release and got themselves into a bad situation.
Right.
Because, you know, there's healthy ways to relieve stress, and drugs, alcohol, those kind of things aren't healthy ways.
No. And so as we kind of look at all those different aspects of mental health awareness, and you know, and even kind of paying attention to our own personal self, take a step back and, you know, look at and try to assess. But like you said, friends looking out for friends too, right. And peers and things like that. You know, be that person that's going to step up and be aware and not have that survivor's guilt. Right. And so, you know, there's even, you know, when we talk about not wanting to talk to somebody local because we're afraid of becoming that rumor mill or
right.
whatever.
Everybody knows, oh, I went to the counselor. Everybody's going to know I went to the counselor type thing.
Right. And so there's national hotlines to reach out to, but because I know when somebody gets into that position of the only thing they can think about is harming themselves to get out of their situation that they're in, regardless of whether it's health or depression or this COVID that's going on. And I don't think that person is really in their right mind and can rationally think about it. So that's where we need to be aware of those around us and be willing to reach out, be willing to take that step, because even that step can be daunting.
Right.
And so what are some of the other issues that you're seeing in the ER that we need to be aware of to help others?
One of the other things that we're seeing an increase of recently is accidental ingestions. So our toddlers, we need to keep items that aren't safe for them locked up, put away, lock our cabinets. They're getting into, medications, medical marijuana, all of that, edibles. You've got, with the medical marijuana, you've got all the edible stuff. It looks like candy, tastes like candy. They think it's candy. Same thing with medications. So some of them are bright colors and they look good. So they're going to eat them because they don't understand what they are. So make sure, medications, all of that kind of stuff is locked up, put away. Another thing that's an issue, and we haven't seen a lot of it here, but it is an issue, is with the vaping. It's kind of a twofold. You've got the lung injury from the vaping itself that they've seen a lot of younger, like young 20s to teens with vaping. Vaping related lung injury it has its own name now. There's been that much of it. It's been given a name.
Wow.
So that tells you that there's a lot of it. And then on the other hand of it, you have to be very aware of is the nicotine toxicity. Children playing with the little pods or the bottles of liquid nicotine. Nicotine can kill. And it can be lethal to children, especially if it's ingested accidentally or whatever. They see it, they don't know what it is.
Well, and like you say, it looks like candy, or it looks like something fun, and
right.
And it's just interesting that you talk about the vaping aspect. When I go into the schools, I try to get with some of the principals, and last year when I was asking principals about, what is it, one of the common things that we need to kind of educate on and provide education to try, and their answer, and this was elementary level,
right.
Vaping. They're seeing at the elementary level kids that are getting into their teenagers or parents or whoever's doing the vaping,
right.
and they're having an issue with that. I was blown away.
Right.
I'm like, seriously, they're at that age,
It's scary, and the vaping is, it was initially kind of created as a way to get away from smoking and how to help you, but it's became kind of, fashionable. And, they make all these neat, cool looking devices, and, they're flavors, and they taste good, and they don't stink. And so they're, and people are, oh, well, this is healthier for me. It's better than smoking. And so the kids just see it, and it's cool. It looks neat. It's not a cigarette. It doesn't stink like a cigarette. It can't burn me. They think it can't burn them. But we've seen burn injuries with vaping, where the devices blow up in somebody's face and cause, severe burns. So they're not healthy, they're not safe. But the kids, their perception is that this is a healthy alternative to smoking, and so it's perceived differently. And so then the kids look at it and be like, oh, well, this is cool.
Yeah, and it's rather new, so it's innovative, but yet there's not a lot of data.
No.
But we're starting to see that information coming around and seeing that there is they may have gotten away from smoking, but have
right.
they gotten away from ingesting the nicotine and who knows what else they put in those devices?
Right.
And
there's quite a few chemicals, the preservatives and all that stuff. You're still inhaling chemicals into your lungs, and it's hot. I mean, for it to become a vapor, it's heated electrically instead of, you know, burning the tobacco. And that's where these vaping related injuries are coming from, is these chemical burns to the lungs.
Right, and even the charging devices, they catch it on fire. So it's not only causing internal injuries, but it's burning people as well. And so it's a rather, I don't know, interesting way to think that people are safe, but yet, and there's people can get this on the black market and getting it with all other kinds of drugs mixed in with, you know, their vaping devices, and so it's definitely a very different world than when we grew up as kids, and the dangers that are out there, and you know, and us as parents and grandparents, what we kind of need to watch out for. And it's, you know, so looking at those different things that are affecting our kids, and, you know, not only depression, but, you know, the environment that they're in, and the world as we view it now. It's you know, we need to educate ourselves.
Absolutely.
And now, granted, I know you can go on the online and find all different kinds of things, and of course, if you find it online, it's actually got to be true, right?
Oh, absolutely.
But no, reach out to community. You know, I mean, because are you available at the ER for information and education, and we want to get into the schools, and to be able to stop. You know, regardless of what age a person is, we don't want them to get hurt. We don't want them to have that. So once again, Danielle Poteet, I appreciate you joining us on this edition of Safe and Sound, and look forward to working with you in the future on different educational topics. And thank you for joining us for this edition of Safe and Sound. Join us next month for another edition of Safe and Sound.